This week we're discussing global health. Global health, a definition is here, but it is an area of study. They're doing research on it. But what it does is it focuses on improving health and achieving equity in health for all people throughout the world. And there is a long definition here, but basically it's saying that for us to be healthy, we need to stop thinking about boundaries, because with air flight and everything, there is just not, you can't just be isolated in your own country. The health of everyone in the world is going to affect the health of everyone else. We know that we are more interconnected. We look at global health because of the humanitarian and economic impacts. Security, bioterrorism is a thing that we would like to eradicate, so that that impacts our security, not just our health. Equity, health equity, trying to get rid of health disparities, not just in our own country, but throughout the world. The impact on the environment, forming global partnerships to better be able to research and be more effective in providing health care and finding solutions, and then really focusing on preventative health care globally. So when we talk about global health care, the organization which we are no longer a member of that looks at global health care is the World Health Organization. It was established in April of 1948. Its headquarters is in Geneva, Switzerland. And there are key aspects of this organization that I have listed here: how it was mandated, how it's governed, the focus area. I have not updated this to say that we are no longer part of the World Health Organization. But the thing about WHO is it covers a broad range of health issues. A lot of it has to do with communicable diseases, not just like COVID-19, but like HIV/AIDS, and then non-communicable diseases that have an impact globally. When you think about maternal child health, mental health, nutrition, the big diseases, the big three: cancer, diabetes, and cardiovascular disease, looking at that. It provides technical assistance and serves as like a repository, developing research and evidence-based guidelines and coordinating international efforts when there are health emergencies. It just has served, it has helped to have that global view of healthcare. Key WHO initiatives are eradicating polio. Even though we don't have polio in our country, it does exist in certain parts of the world, and trying to get vaccination campaigns to eliminate polio everywhere. Trying to decrease and reduce the burden of malaria. TB is still a thing in the world, even though it's not as widespread as it once was. Focusing on that. Vaccination. Global health security focuses on really looking at how to strengthen response to disease threats, especially infectious disease threats. Working on decreasing the use of tobacco. There's a Health for All Film Festival, and these are just some of the examples of their initiatives. WHO helps global health policy by setting health priorities globally. It helps to set norms and standards, not just for one country, but amongst all countries. It provides technical assistance, particularly to countries that need help to maintain and implement and monitor health, not just preventable health, diseases, and communicable diseases. It serves to, the big thing it does is encourages coordination and collaboration to be more efficient in health response, advocacy, and awareness. It's crucial in shaping the global health role, even though our country is no longer a part of it, and that is our administration's focus, but they will still be working out there, and hopefully there will still be interaction with the United States. The National Institutes of Health are also being looked at right now, but they are the National Institutes of Health is the primary agency responsible for biomedical and public research. There are 27 institutes and centers. Each has a special focus. The mission, the research focus, and how it's funded are listed on this slide that I'm on now. The funding is up for review because health research funding has been paused, so I'm not sure where we are going with this now. It advances our not only our research, but improves public health. There's global research funding, and there's other funding that within the United States that the NIH has sponsored. I'm not sure. There's some slides here that talk about that. I'm not sure what's going to happen. I'm sure there will be research, there will be funding, but how that goes forward as the current administration tries to determine, and I'm not making a stance either. I always make the stance towards health. They feel that there is unnecessary spending, and I'm sure there's an unnecessary spending in something as big as the United States government, but hopefully our health care will not be negatively impacted. And the NIH collaborates with international organizations to ensure that we're sharing information and working together, including data sharing and policy development. NIH and who have historically worked together to look at health globally. I think that I'm not sure what's going to happen in the current administration. I think right now everything is paused while they consider where waste and waste, fraud, and abuse are occurring in the government, and what direction the NIH and the Department of Health and Human Services should take moving forward. But these slides and the other set of slides should help you answer the questions for my course in this minuscule piece of time, even if some of this is now probably historical. Thanks. Have a great day.